every single patient who's treated with, say, very advanced techniques such as IMRT radiation therapy, stereotactic body radiation therapy, 3D conformal radiation therapy. Each patient has a plan that's customized to their particular anatomy, to their particular type of cancer. Some cancers require more radiation to cure than others, and to the size of the tumor. So all of these variables go into creating a specific plan that's specific for that unique patient. Patients come into radiation therapy and they undergo a CT scan and then a treatment plan that's specific for them and their cancers, created with advanced software. And then the medical physicists who we work with take that plan and do measurements on the treatment machine to make sure that the treatment that was planned is accurately delivered by the machine, because there's so many moving parts. And just like when you buy a car, you have an owner's manual, and every 3,000 miles you change the oil, and 15,000 miles they check other aspects of the car. Linear accelerators have this same type of quality assurance measurements, where they have daily measurements that are obtained for very routine things, such as to make sure that the machine is spinning around an exact point called isocenter. They measure the output of the machine, and then there are other measurements that are taken on a weekly or monthly basis, and some even on an annual basis, just to ensure that the machine is actually functioning properly. And then there are patient-specific measurements, where the physicist would take the actual plan that was planned in the treatment planning software and verify that it's actually safely being delivered to a piece of plastic, basically, prior to the patient being treated. But currently, there aren't generally accepted methods for actually measuring the dose that a patient's receiving when they're actually getting their treatment. And that would be a huge step forward in quality assurance for patients. So we were fortunate to have a Buchanan grant, where we were part of the basic science of and the clinical translational work of this Buchanan grant, which was to develop a program to provide cancer patients highly accurate and rapid palliation for pain, and even treatments for tumors around the spine and so forth. We wanted another layer of quality assurance, and so we've been working in collaboration with TomoTherapy to use the CT detectors of the machine to actually measure the dose that's coming from the source of the radiation unit through the patient and into these detectors, and have done some pilot studies with some beta software, and have been able to measure this dose to within plus or minus 5%. So we're very excited about this being a new layer and level of quality assurance that currently isn't provided routinely to cancer patients, but is probably not that far off in the distant future, given the tremendous complications that can occur if in fact you do have an error in treatment delivery or planning.